University of Chicago Medicine is a unique academic medical center. Patients seek us out because they certainly have complex illnesses, but they also have illnesses that are life-threatening and very stressful for them. The reason to come to University of Chicago Medicine is we offer not only just innovative therapies for patients, novel therapies for patients, you will get a view into tomorrow's therapies here today.
I think the University of Chicago prides itself in being able to provide a welcoming environment for people who have ideas that are unconventional. And our campus has many people who don't quite fit into the conventional boxes. But they are innovative, they're creative, they've got interesting new ideas, they challenge existing paradigms in creative and constructive ways.
We at the University of Chicago Medicine within the international program want to make sure that patients from all over the world can get access to some of the best care here. We're recognized as one of the top teaching hospitals in the nation. We have a variety of clinical centers of excellence, and just to name a few, we have a designated comprehensive cancer center. We have a heart and vascular center with transplant outcomes that are some of the best in the state of Illinois right now. We have a world-class women and pediatric center. So from a clinical perspective, we have state-of-the-art care for our patients. We recognize it's hard for patients to leave their homes and come here for care. And when possible, we try to keep patients in their own homes for care. But when they can't, and we recognize that we have a therapy or we have some kind of a procedure or a clinical innovation that will help a patient based on the condition that they have, we do what we can to make sure that we get them the best care here.
So for every single patient who wish to come to University of Chicago Medicine, when they first submit their request to us with their clinical records, so I first review these records and making sure they are sent to the appropriate specialist for review. So here we're making sure everyone's case is triaged to the right person, and we want to make sure we can make a difference. So if after review there's any treatment options that's not available in home country that we can offer here, we will go ahead and let the patients know.
We pride ourselves to have a state-of-the-art 5-star level guest services unit for international patients. What we do is we start communicating with the patient prior to arrival to the United States. We work with them on understanding their needs from housing standpoint, and we give them an area of choices or where to stay depending on their preference. So we are able to place our patients in hotels, in extended stays, in corporate housing. Upon arrival, we have a tailored meet and greet service for every single patient in the airport. So when the patient arrives to land in Chicago, we have a team that will go and pick up the patient, drop them free of charge at their destination here in Chicago, check them in also in their whatever they're staying, whether it's corporate housing or whether it's hotel. We set up their cell phone service, we set up their banking, and then we give them guidance about ethnic grocery to them. If they're looking for worship places, we guide them through that. Basically, we answer all their questions that they have. Anything that is non-clinical, the guest services unit is in charge of.
So as an international program coordinator, I am like a liaison. I act as I connect the patient with our physician, our care team here in the embassy, which is like the guarantor. All of us coordinators are also certified interpreters. In addition to having interpreter services, we have in-person interpreters, and we also have over the phone 24/7 and iPads available to our inpatients. We put them in the room. We stay in communication. We would remind them about their appointment the day before. If there's any instructions, any labs, any results, anything like that. So we're always touch base with them just to ensure that patient understands the plan of care from every aspect and facilitate communication between them and our care team.
Everything was arranged basically from the ambulance. Since we started coming here, they offered as well to give us accommodation. They provided a social worker to communicate with us, and of course Claudia was daily with us, talking to us. Even if we are not there, she would visit Suleiman every day. We would talk to her to communicate with other doctors if we had any comments or complain, I would go back to her. So everybody was helpful and professional and emotional at the same time. So I'd like to thank them all, all the staff, medical, nurses, social worker, everybody actually was doing a great job.